sustainability comes by the number of stakeholders that have been involved in this project. France just came in as to support, given the unfortunate circumstances that happened here in Homa Bay last year. But we feel very comfortable, or we feel very confident that the local actors, being the local government, the Homa Bay County government, the UNICEF and the Kenyan Red Cross, and more importantly, the resilience of the community. I was very encouraged to see that people, without being asked, have been building dikes, have been building trenches in order to prevent the water to come. So I think the sustainability will come by the association of local partners and the community itself. I think we've seen the support was really focused on nutrition, and especially on young children and lactating mothers, but we know when there's a food crisis are the most vulnerable communities that are being affected. So our support came in form of supplementary food that were given after a thorough examination of the patient in order to avoid severe malnutrition. So I think it has been proven a very, very efficient program. And let me perhaps by concluding, saying a few words that France next month will organize an international global conference on nutrition, and the objective of this conference is to raise awareness on the very issue of nutrition, because the global needs are huge, and I think we need collectively, politically, to prioritize the issue of nutrition in our aid development and our international affairs.
We have floods twice a year, and this place actually serves as an evacuation camp. Here we have a lot of mothers every year who are mostly affected, mothers and children whose farmlands are swept away, their food is swept away, they are displaced. And when they come here, many times the children are malnourished. So this project has been supporting maternal and child health, which is a high priority for our government, Her Excellency Gladys Wanga's government, maternal and child health, children up to children under 5. The program has been supporting food supplementation. The program has been providing cash transfers for people who have been affected, and general monitoring of child health.
UNICEF is equally affected by the funding cuts from US aid. But I think, as you have seen in the media, there's a lot of reflection about how can we turn this into an opportunity as a country. How do we mobilize our own local resources? How do we increase domestic funding for the programs that we have at county level? How do we increase our own source revenue, as own source revenue in counties? And so this is something that came as a surprise to many people in the world, and people are re-strategizing. We're beginning to look at different sources of funding and countries as well. And so, but I also believe that we have local solutions. And I think when we were talking, as you saw with this community, their resilience and their focus, they are not waiting for funding from anywhere. They have already started, as you had the ambassador saying, to look at how they are going to mitigative interventions, because next month we have the March-April rain season. And so we are looking at community resilience, even as we look at how do we reposition ourselves as partners and as a country to really address this issue of change in the funding architecture around the world.